this fireside chat about having Professor Golden here with us. It, of course, would not be a fireside chat if I didn't talk a little bit about things that the union is involved in. So I wanted just to say a few words about the current initiatives being led by graduate students and PTLs, and then introduce our wonderful speaker. So I think in the chat box, the link to these two initiatives has been shared. There's a CARE Act proposal drafted by graduate students and also a PTL petition. And the CARE Act proposal is, the graduate students have really taken initiative to think about the utilization of the $27 million that's been given to Rutgers by the Department of Education, about how it could be most effectively allocated with the Rutgers community, both undergraduates and graduate students, and equitably across all three campuses. So I would take some time, read their proposal. It's really incredible. It lays out a format for a centralized decision-making process that would take the decisions out of individual departments and put it in a kind of central structure, and that it would be allocated on the basis of financial need. I think that as difficult as this time is, it's also forcing us to develop some new modes of organizing and thinking about our jobs, about higher education. And I think this is a really important and innovative idea about how to have a democratic response to the COVID crisis through a fair, open, and equitable process that makes monies available to those who need it most. So look it over, share it with your colleagues. Yeah, enjoy it. The second thing I wanted to share with you is the PTL proposal. So there is a PTL petition that is calling to end the proposed 20% cut to the PTL staff, to their budget. And it's also stressing that PTLs, part-time lecturers at Rutgers, should have immediate access to Rutgers health clinics and all other uninsured part-time employees at Rutgers free of any charge. So it's both pushing against the idea of a cut to the part-time faculty for next year and also giving them immediate access to healthcare, which is, of course, the most pressing need during this health crisis. So now it's my pleasure to introduce Professor Janet Golden. It's really a pleasure because she's also one of our own, both as a celebrated historian of medicine and past president of the Camden chapter of our union. She's published widely in the history of medicine, women, and children in the United States, and her most recent book is Babies Made Us Modern: How Infants Brought Americans into the 20th Century, published by Cambridge University Press. In addition to serving as past president of the union, she is also the regional organizing coordinator for Swing Left in Pennsylvania. This moment is an unusual one in that the history of the 1918 flu pandemic is repeatedly being used and referenced in policy, epidemiology, and even electoral responses to the COVID-19 crisis. So we're truly blessed to have our esteemed colleague give us a historical analysis of this pandemic.
So let me say thank you, Donna, and thank you to the Rutgers AAUP, which made it possible really for me to have a fairly compensated career and now to enjoy a phased retirement. And I am always with you. I will always be signing your petitions as an emerita professor, and I am with you. And because I hear from my friends who are PTLs, I'm very glad to learn about the petition. So I'll just begin, although this talk is labeled lessons, I think we might say lessons unlearned from 1918. And I'm going to try and be as quick as I can so we can have discussion. I will say that people are now talking about this as, oh, it's a global event. Well, ever since the American Revolution through the Civil War, we've had global pandemics. They were spread by ship then. They were spread in 1918 by train and ship. And today, of course, they're shared by aviation. Americans in the 1918 knew that people, especially immigrants, lived in crowded, unsanitary environments, were most likely to become sick. Some people then, as now, saw epidemics as signs from God. Some people put great faith in medical science. People distrusted outsiders. And I think my favorite example of that from earlier epidemics is when there was a yellow fever epidemic that broke out from the shipyards in New Orleans, and the people tore up the train tracks leading to Memphis because they didn't want people fleeing to Memphis. So, and yes, there were always people selling fake cures and preventive treatment. So that's kind of a background. I think what's particular about 1918, and it's something I've never, it's one thing when you teach this, and then it's another thing when you live through a pandemic. And one of the things in 1918 that we have to be cognizant of is from the British and the American experience of colonialism, we developed a lot of false beliefs about those diseases that lower civilizations in Asia would send to us, but we higher people of privileged civilizations would have a sort of natural resistance to that in some cases. In other cases, it was about kind of civilizing other places so they could live up to our standards of hygiene and health. So there's an undercurrent of racism that's very much in the thinking of the elites in the 19th century that's going to be exploded somewhat in 1918. And of course, it's in conjunction with eugenic thinking and who could and should survive. And of course, we see all of this today. And so, it's a little bit weird to be living it. So I just think about the background of sort of whiteness and globalization is undergirding so much of 1918. I'm going to do a share screen, I hope, and say that, of course, what's different about 1918 is, let's see if I can get rid of it. Can you see that?
We can.
You can? Good. Okay, so just to give you a sense of the deaths in 1918, American deaths, obviously the World War I had about 20 million deaths on both sides and another 21 million casualties. But it's very much, people used to call it the forgotten pandemic because we were engaged in that World War I conflict. There were 2.9 million US military on active duty in 1918, and many thousands and thousands of others in supporting roles. One thing that was different in 1918 is with the sea lanes closed because of the war, there was very little immigration from Europe. And of course, we had our Asian Exclusion Acts, and there was immigration from Mexico. But by and large, immigration was halted, although at that point, the United States had its largest percentage of immigrant and immigrant offspring population. But people were not paying much attention to the influenza outbreak because of the war. There was some censorship around the war. There was censorship around the influenza. And when you have the mass casualties of World War I, 1.1 million in the Battle of the Somme from July to November 1916, the daily death tolls from the influenza may not have penetrated people as much. So let me give you a little, let's see if I can go to the next one. All right, I guess I got to get out of that. I don't know why it's not going. There we go. So that's just a sense of the worldwide pandemic from the fake news Centers for Disease Control and Prevention. So about a third of the world's population were infected. It was a very high case fatality rate. And the deaths are estimated between 50 and 100 million. We don't have very good data from China, India, Pakistan, much of Africa. So we just don't have the kind of data we should have. But we've really aware of the undercounting there. And again, by way of comparison, World War I is maybe 20 to 37 million deaths and casualties. So the United States escaped relatively lightly with only 675,000 deaths out of a population of 103 million. If we had the same case fatality rate today, it would be about 1.7 million deaths. Now, there are 3 phases to this influenza. Let me go back a minute and say it looks like there's a hill, an early outbreak, then there's that big alpine peak and in 1918 that most people are aware of, and then there's a follow-on kind of smaller peak in 1919. So it's a moving pandemic. And particularly interesting is that mortality is highest among those between 20 and 50, we'll call it. People in their prime working years, the people of the age to operate our transit systems, to deliver the mail, to produce our factory goods, to tend to the sick, to take the goods to market. So those people are the ones who are sick and dying. And as a result, life expectancy in the United States is going to drop by 12 years from 1910 to 1920. Life expectancy, 12 years in that one decade. The reason mortality was so high in that age group and so much lower in the older population is there were a number of severe flus in the 1890s, and the folks who survived that had some immunity to the 1918 flu. So a lot of people call it the Spanish flu because it was, Spain was the first country to announce that it had been struck by an epidemic. But for us, for many people, it was known as the Hun flu because of World War I. The Poles called it the Bolshevik disease. And the Russians blamed nomadic tribesmen, and the Germans blamed Chinese laborers that they brought in to dig trenches for the war. So we're always going to blame somebody else. And at the time, it was not clear that, this may sound familiar, that all nations were reporting accurately on their epidemic outbreaks because of propaganda purposes, and at times the media, the newspapers of the era, when they were on the hunt for information, were kind of thwarted by government agencies. Now, today we understand that our COVID is a virus, but in 1918, the flu was thought to be caused by a bacteria. It was not until 1933 that we knew it was a virus. And it was diagnosed based on respiratory symptoms. You couldn't culture it, you couldn't take it into a laboratory. It was not a reportable illness. And also in 1918, we had 40,000 physicians and 65,000 nurses overseas. So then as now, we had to call on a lot of students and volunteers to help out. Now, one of the other things that we didn't learn from any of our past epidemics, apparently, is that when people live in congregate institutions, boarding schools, nursing homes, prisons, they are more, shelters, they get more exposure and they're more likely to succumb. So rather than give you data, I'll just leave you a little quote here about these villages. As you may know, the Navajo Reservation has, I think, the highest rate of COVID positivity today. The same was true in the Native American schools, in Native villages in Hawaii, Alaska, and everywhere. And all very depressing, right? I'll just leave that there. So our public health infrastructure has changed since then, maybe. But it was largely a local and state matter. The United States Public Health Service wasn't created until 1912. But we did have a Surgeon General since the time of the Civil War, and the Surgeon General, Rupert Blue, was putting out all sorts of useful advice, which may sound, well, we don't have those common drinking cups anymore. But otherwise, probably sounds pretty familiar. Wash your hands, sneeze into a cloth, wear a mask. And it was spread by public health posters and newspapers. Influenza is a crowd disease. And no mouth breathing. So pretty much what we get nowadays. And because we had so many physicians overseas, you're always told what to do until. So people got sick. Sometimes they died very quickly within hours of falling ill. They'd have fevers, aching bones, they'd get pneumonia. They'd turn blue and then black from a lack of oxygen. And they died. And oftentimes the corpses had to be put out in the street and then into mass graves. In Philadelphia and in other places, they ran out of caskets and grave diggers. People, they kind of picked up the bodies in wagons and took them to emergency morgues, as we had done in Philadelphia for the yellow fever and the cholera. So this really struck me when I saw the picture in the New York Times of the mass graves being dug in New York, because I was so familiar. I mean, obviously we have better grave digging equipment now, but it seems so familiar to me. And I guess when I taught this, I never kind of expected to see this again. So we took care of the sick. I will say Philadelphia had an unusual experience because we had our Liberty Loan Parade on September 28th. 200,000 people came out to view it. Greatest the city had ever seen, the newspaper said. And then the following week, our deaths peaked and they continued to climb. But let me go back here for a minute and just say a little more. I know it's being a medical historian, a little more about the dead, but we have this high death rate in Philadelphia. We have a single morgue. It has the capacity of storing 36 bodies. The corpses kept arriving. They get stacked 3 or 4 deep in the basement of the city morgue. And then the stench got too bad. And then they had to open the doors to get the smell out. And then people would walk by and it became kind of a sideshow. And then finally the city erected 5 new temporary morgues, which I thought about a lot when I saw the trailer trucks parked in New York. And then the federal government, under Secretary of War Newton Baker, sent embalmers to Philadelphia at the request of the mayor. And the Council of National Defense organized a lot of local companies with woodworking equipment and contracted to build coffins. And the government imposed some laws that you couldn't charge more than 20% over your usual coffin prices. But they were in such demand that people had to hire armed guards to protect the coffins. So I guess we're not there yet. Yes, we did take care of the sick. The only thing you could do for people was supportive care, which meant that nurses were the most critical people involved. Volunteers from the Red Cross came forward, particularly to care for all of the orphan children. And there were a number of them because of the age at which people died. But sometimes there was nobody to care for them, and really people literally starved to death. There were segregated wards in the hospitals. Eventually the military, I read a lot of letters from people in the military during 1918. Eventually those wards were integrated, but I don't think they were made public about that. That's a segregated hospital with African Americans tending to white soldiers. We had tent hospitals, as we seem to do now. And we had these mass casualty hospitals. The one thing that was new that I'll give a shout out to was the motorized ambulance, pretty new in World War I and for the influenza victims. Although we may want to get back to a greener world, the advantage of a motorized ambulance, particularly in battlefield evacuations is they stop and start more smoothly than your rapidly moving horse-drawn carriage. There was social distancing, but this is harder in 1918 because we don't have supermarkets. You had food stored in an ice box, or you shopped every day if you lived in a city. There were very few preserved foods. So you had to go to the produce vendor, the butcher shop, the bakery. So there's just lots of contact going on, and it's a cash economy. So people made frequent visits to the bank, and those were the last institutions really to close during epidemics, because the government was afraid if they closed the banks for social distancing that it would lead to runs on banks, that people would fear civil unrest. So saloons closed, schools closed, not in New York City, the schools stayed open there. A lot of places selling food closed eventually, and that probably looks familiar. The incubation period for the flu back then was 72 hours. And that had different patterns for isolation and quarantine, but it also meant that you could load up a troop ship with soldiers, and 2 days later, those ships were like floating morgues with bodies buried at sea by anybody who is still alive. So how did you prevent the flu? Isolation, quarantine, same thing we're doing now. And we had a lot of great quack cures, and my favorite of which were onions. I'm not sure the mechanism by which they were supposed to work, but a lot of people ate onions, raw onions at every meal. And one woman made her sick child live buried in raw onions from head to toe for 3 days. And I guess in that case, it did work. The other thing that we got going in this period was anti-spitting campaigns, which had always been part of the anti-tuberculosis movement. In Philadelphia, they did arrest people for spitting, and the wearing of masks. And I know in San Francisco, they arrested people for not wearing masks. But mostly people, especially after the disaster in Philadelphia, tried to ban mass public gatherings, because you would have a public gathering and disease rates would spike right after that. There were some communities that self-quarantined. They closed off entirely and did not let in any outsiders. And that was called protective segregation, and it worked. The Center for the History of Medicine at the University of Michigan did a study of them, and that was commissioned in 2005 by the DARPA, the DTRA, not DARPA, the Defense Threat Reduction Agency. And they basically said that's the only thing that works. So the San Francisco Naval Training Station closed to outsiders. Princeton University closed to outsiders. Bryn Mawr College closed to outsiders. Fletcher, Vermont closed to outsiders. The School for the Blind in Pittsburgh closed to outsiders. People had to leave food and mail outside, and then it would be brought in after a time. And they had low morbidity, low mortality, or totally escaped that. So protective sequestration, which I think we ought to try with the White House, but that's a personal opinion. And then we have the second wave in 2019. Again, and I know that we've been predicted to have another second wave. So let me just show you another. I really like this quote, because after the 2005, the avian influenza, everybody came out and said, we have to prepare for the next pandemic. And the head of a number of NGOs went to and this is 2005, the Bush years, went and said to the national stockpile, you have to get more ventilators and masks, and you should have a line in your budget so that every year you can throw out the expired ones and get new ones in there. And they pushed for worldwide surveillance and case reporting. They've pushed for an infrastructure for vaccine distribution, production and stockpiling of antibiotics and antibacterials and antivirals. And I guess they didn't do a good job. And finally, I want to close with this, which is we did have an election in 2018. We did have an epidemic and we did have an election, and we didn't do vote by mail, but they did fumigate. I don't know what good the fumigation did, honestly, but they did have it. So there is precedent, just in case you're worried, there is precedent for holding an election during a pandemic. And I think I want to stop and just answer questions. It's pretty grim out there. I think we didn't learn many lessons from 2018. 1918. We didn't learn a lot of the lessons from 2005 when we merely had the threat of the avian influenza. So I don't know, it's pretty depressing. So I'll just stop right there and go ahead and ask questions. Oh, I think I'm under time budget.
Yes, wonderful, wonderful job bringing us in to exactly the minute. So the floor is open for questions. You can try raising your hand. I can't see everyone. I can only see, even though it's still gallery view. So the best bet is to put yourself on stack, but I will also be looking for hands.
I opened the chat, so I can, if you post something there, I can answer it as well.
Perfect. Sean? You may have to unmute.
Okay. Hey, that was super fascinating. Thank you. So I guess this may be a super big question, but the current crisis, I think, seems to many of us like probably a kind of pivotal moment historically, and there'll be many different social and political changes that will kind of come of this moment. And any lessons from the kinds of changes that you see having resulted from the 1918 flu for those of us trying to kind of push current changes in maybe a less terrible direction than they might go in?
Well, I'm a medical historian, and
should I know that's super big? I'm sorry to give you like a whammy question, but if you got anything.
I have spent, when I'm not being the professor, I've spent a lot of my life advocating for what we now call single payer health insurance. So I guess, it was so different because, of course, we had the problem of war reparations in the 20s that led directly into World War II. We had the beginnings of an agricultural depression. And there was that, Harding era return to normalcy. So I would say not much good happened in the 20s that suggested we had learned our lessons from the pandemics. Certainly we didn't get past the racism with which we viewed all the deaths in Asia, and the superiority sense of the white man's burden there, or racial superiority. We certainly, in the wake of that, we passed the 1924 Immigration Act that really cut off the flow of immigrants. I would say the 20s were real. We see the rise of Jim Crow violence in that era. So maybe I'm a historian. I always focus on the bad stuff. So what's going to come out of this? Probably like everyone here, I kind of wake up every day and see that we're handing out billions of dollars to wealthy people, wealthy corporations. We're undermining our environmental infrastructure and our minimal regulatory state. So, and ironically, of course, it's as we all sequester, we can't actually get in the streets and make demands. So I am not optimistic, but I would like to be proven wrong. I just don't see how, I think it should be clear to everyone that we need a national health system. We need a public health infrastructure. We need a public welfare infrastructure. We need to rethink our mass incarcerations and the deadliness that comes to our society and to those who are incarcerated. I feel like I know what we need to come out of this, but and I'm working on it as an individual activist, but I don't know how we're getting there. So I wish I could I wish I had a happy answer.
Shauna, you have your hand raised. You may have to unmute.
I'm muted by host. Can you hear me?
Yes, we can hear you. You can turn your video on, Shauna, so I can see you.
Oh, did I turn it off? Sorry, I was eating my dinner and I thought that was rude, but the baby didn't go to sleep.
Holly and I have our drinks, so.
I'm sorry, I can't find the video button right now. It's not working.
Bottom left.
Thank you.
Hi.
Thank you for your scholarship and kind of knowledge on this, Janet. You started to answer my question already a little bit with your last remarks. You're a historian and I'm thinking politics. I'm a political scientist. I'm trying to think about what the government should have done and when, right? So if you could go back to 1918, it's clear that Philadelphia should have stopped the parade, right? Are there other moments when you saw there was something the government clearly should have done either then or now? Because I'm not saying we've done a really good job, but our governments, at least in certain of the states or in many of the states, have done some of the things that you're talking about. I'm not sure we haven't learned anything, but I'd love to know what you think we should have done or should do now.
As I said before, because we just had our public health service founded in 1912, we didn't have a strong public health service. They were traditionally focused on diseases that came in by ship, yellow fever, malaria, things like that, because the ports were a federal responsibility. But it was up to the cities and the states to police healthcare, as we might call it. And some cities had very good, Milwaukee, for example, a very good public health infrastructure. New York had a pretty good one. Philadelphia, okay, not great. And it was the Commissioner of Public Health who okayed that parade up Broad Street. So I don't think that was a government failure, not a popular failure. And the government, unlike today, at least they did try and regulate price gouging and did try and get accurate information out there. So it was also, I think it's an important difference that I didn't really stress, but in our big cities in 1918, there was so much poverty, so much poverty. So people often say, well, Philadelphia closed the schools and their death rates were no better than New York, where they didn't close the schools. They didn't close the schools in New York because there were so many poor children, 75% of school children, living in tenements, in crowded tenements, the whole family in one room, malnourished, that the school board and the health board figured it's better for the kids to come to school and be inspected by the nurse every day and get the care that they need. So it's hard to analogize to what the government did. And again, I think about the critics on the right with the nanny state, arresting you for spitting, arresting you for not wearing your mask. And is that really an effective, should we be educating people and not arresting our way out of the problem? But then I have to confess, I go outside and take a walk every day, and I see all these groups of young people huffing and puffing, running by me in clusters, and I'm like, those people should be stopped. So I'm of two minds about it. I have a political sense and a personal sense. But the government, they were so denuded of resources and healthcare personnel because of the war that it's hard to analogize that part to today. I know that Steve Collin in New Yorker wrote about Woodrow Wilson's heart being damaged from his bout with influenza, and how perhaps his negotiations thereafter in some of our World War I treaties were not as effective. And I'm not a Wilsonian scholar, so I can't really speak to that. It's amazing how much we all don't know, right?
Do we have other questions on Stack? I can't see everyone, and I can see only a portion of the chat box. Yes. Oh, unmute, please.
I'm Jorge Chiment. I'm Nancy's partner. And one of the characteristics of the current pandemic that has struck me is the very strong resistance against taking public health action by citizens who are protesting and who are doing so very aggressively. And it makes me wonder if something similar happened in 1918. And I think today it's motivated by a kind of pro-religious, anti-science sentiment, if that might have been the case then as well.
That's a really good question. I think that in 1918, again, because so much of our population, young people were dying, young parents, young workers. I think they really, I think they really did look to authorities for help much more. And, so many of our young men had, in World War I, you could enlist with your friends. So the whole town, everybody would go down and enlist or whatever, get drafted, they'd go together. So there was kind of an investment in our boys and in winning our war once we finally got into that I think there was much less resistance to the government advice than what we see today. But also it was, it's hard to, when I read stories in the New York Times or the Washington Post, they're always talking about all these basically middle-class people and the problems that they're having through the COVID, having to shelter or whatever. But at a time when our poverty rates were so much higher, and I think we don't pay enough attention now to our impoverished population, but when our poverty rates were much higher, it was really just about getting volunteers and resources to helping these people. We didn't want bodies in the streets. We wanted, so cities did organize teams of doctors to go out and visit families. Sometimes, they had early, by telephone, remember those? You could call up and then volunteers would come out and help, or the Red Cross or the visiting nurses, things like that. So they really there was some effort to get resources to people, but it was not well coordinated. But I didn't see the same kind of it's ironic because we have a lot more effective science now, but I didn't see as much, yes, we had a Scopes trial and all of that, but I didn't see as much resistance to science or local public health authorities then as I see now. So I think it comes from a political place that's being undergirded in some unfortunate ways.
Yeah. We are right at 9:15, but if it's all right with everyone, we started about 5-10 minutes late. Maybe we can take one more question and then wrap it up. It just says Axelrod. Please unmute.
I think I'm unmuted. Can you hear me?
Yeah.
Was there civil unrest during 1918?
There were some there was some resistance to the war, certainly. It was more we don't, anti-war activism than anti-science or anti-whatever.
So were there people who couldn't get food that were
they couldn't get food, they were sick and dying.
Oh.
It's very hard to imagine, I think, a city where every day there are thousands of bodies left in the street for the carts to pick up. And again, when you have people from their 20s to their 40s being the highest casualty rates. The parents, the workers, it's very different than it is today, where we see more deaths in our older population and in our health compromised population. And because it was so quick, you know, one day you're at work, you don't feel well, and then 8 hours later, your body's on the street. So it just had a different time dimension. I will say also, what was different then is there was a fair amount of censorship about how bad the influenza was, because we didn't want to undermine morale in wartime. But you can get a sense that people knew, because if you're a historian like me, and you have to read the ads in the newspapers from 1918, they always say like, oh, we need young women to come sew uniforms in our factory. And you know, we're a really hygienic factory. So I think that because it was striking those people at the prime of their working years, and because it killed so quickly, it was quite different. Also, the pace of it was very different, because we have, you know, for our big wave, it arrives in September, mid-September, and then by November, it's pretty much gone. So it moved, it was that big spike was about a 12-week period. So here, you know, now we're told, you know, we're not getting Oktoberfest, and we're like, oh my God, I can't deal with it for that long a time.
Yeah. Thank you for your presentation.
Thank you.
Silent clapping. Thank you so much.
Oh, okay. Thanks, everyone.
Silent clapping.